Hi, I'm Scott Hummel. I'm an assistant professor and cardiologist at the University of Michigan and also a staff cardiologist at the Ann Arbor Veterans Affairs Health System. Today I'm going to be talking about our upcoming manuscript in Mayo Clinic Proceedings, Impact of Prior Admissions on 30-Day Readmissions in Medicare Heart Failure Patients. As many of you know, approximately 1/4 of Medicare beneficiaries who were hospitalized for heart failure are readmitted within 30 days of hospital discharge. And not only is this a major impact on the lives of individual patients, but hospitals are being penalized sometimes millions of dollars a year for inappropriate readmissions in their Medicare patients. Okay, so we studied 1,764 survivors, Medicare beneficiaries admitted for heart failure in the state of Michigan. And first we looked at the performance of a widely recommended chart-based risk model. It's recommended by the Hospital to Home Quality Initiative and also the VA Heart Failure Query Initiative, and it includes lots of demographic and clinical variables focused on illness severity and comorbidities. And one of the problems with this and many other readmission risk models is that the accuracy is not as high as we would like for individual patients. As an example, the C statistic, which is a measure of the overall discrimination of a model, is 0.58 in the original paper. And just for reference, a C statistic of 0.50 is like the flip of a coin. Of these patients that we analyzed, 27% were readmitted within 30 days, which was within the expected range for the time period of the study. We found that the C statistic for the chart-based risk model was 0.61, so on par with what others had found with similar patient populations. And we asked the simple question of how many times have you been in the hospital in the past year, and we divided into 0, 1, or 2 or more times. And we found that when you included this variable, one prior hospitalization, when adjusted for the chart-based risk model, increased your odds of being readmitted by 5 times, and 2 or more hospitalizations increased your odds by over 6 times of being readmitted within 30 days. And this very strong factor improved the overall discrimination of the chart-based risk model tremendously. The C statistic went from 0.61 to 0.74. And as you'll see in the accompanying manuscript, the probability histogram, or a graph of the expected readmission probabilities, goes from a normal distribution or bell-shaped curve when you use the chart-based risk model alone to a significantly different distribution where most of the patients are in a low-risk or high-risk category. So basically shunting everyone out of the intermediate or middle-risk category into a higher low-risk framework. And that's exactly what you want from a risk model, is identifying low-risk patients that may not require intensive interventions, and hopefully a smaller group of high-risk patients that you could then focus on. So I think our finding has potentially large implications for clinical practice in the sense that hospitals who, again, are often putting forth great efforts and putting in a lot of resources into preventing heart failure readmissions so they don't receive penalties for excessive readmissions, can then target these efforts more effectively to the patients who are actually at highest risk of coming back in. Asking a patient how many times have you been in the hospital, it's fairly easy for that patient to remember 0, 1, or 2 or more. Pretty simple variable that has a profound impact, and we think it probably has or maybe serves as a proxy for some of these other more complex issues, such as social isolation or medication non-adherence. I think if you've been hospitalized several times in the recent past, it's a clear indicator that either you have severe disease, which certainly might be captured by some of these clinical models, or perhaps that something's not going well with the plan of care, and whether that's failure of coordination on the hospital or outpatient structure of care, or whether it's some particular variable specific to that patient. I think the main relevance here is that if you're trying to risk stratify your patients that are being discharged for heart failure, and you have sort of an intermediate probability from currently available risk models, the number of previous hospitalizations can sort of break the tie, can really truly identify the people that might be at high risk. And then I think this is where the extra effort and staff involvement may come in, is individually evaluating those particular patients' case and finding out, what's the real reason this patient came back into the hospital? Are they not able to have proper nutrition at home? Do they have confusion about their medication regimen? Do they have difficulty with transportation to their follow-up appointments? What are the sort of non-cardiac reasons that this heart failure patient might be likely to be readmitted? I think that's how people could use this finding in their everyday clinical practice. So one additional question that's raised by our work comes from the large impact that this previously unmeasured variable of prior hospitalizations has upon one of the most commonly recommended readmission risk models. And the question that's raised is, what else are we not measuring that might have a big impact on an individual patient's readmission risk, and perhaps by extension, an individual hospital's case mix and readmission risk? And I'm hopeful that our work and other work in this area can help payers better understand readmission risk and assess hospital quality.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.